Yeah, well, Consultant Connect, I think, is a really great tool that probably appeals to doctors across the whole spectrum of different specialties. But I think it has a particular relevance for doctors in psychiatry because as we start to become more specialised in mental health, we possibly our fingers fall off the pulse of developments in physical health treatments a little bit, and it can be helpful to have a kind of rapid and direct access to kind of specialist advice. So it's a really useful tool. I think I really liked the concept, and I was interested to hear about it. And I think I was a relatively early adopter when it was introduced in our trust, and found it really helpful for getting that rapid expert advice that I mentioned. In particular, that was really useful on a busy inpatient ward. When I was, working on a ward with kind of up to 25 patients during COVID, there were lots of different aspects of physical health management that often fall to the junior doctors on a psychiatry ward, and it was really helpful for me to make sure that I was able to manage those patients appropriately, and B, for me to learn and develop and grow as a kind of junior doctor, and make sure that I was kind of keeping up to date in that sense. So yeah, I think it's a really interesting area, that kind of interface between physical and mental health, and getting involved in evaluating whether this was an effective tool seemed really appealing to me, basically. I think that one of the main things we found, and the feedback that we received from the junior doctors who we interviewed, was that overall Consultant Connect was felt to be a really effective tool, a great way of getting quick advice for particularly non-urgent but specialist physical health issues. So it was still felt that if something was really urgent, an emergency, then the most appropriate thing would be seeking kind of immediate advice or support from kind of A&E. But in those kind of non-urgent situations, it was a great tool for people to get some specialist support. It was felt to be simple to use. It was felt to be something where the doctors who were using it, the junior doctors who were making the calls, really felt like they were speaking to people who had a little bit more time than perhaps speaking to a medical registrar, speaking to somebody who was, a specialist in that field, rather than speaking to the general medical registrar who's swept off their feet, and thinking about 101 different things, and always often giving great advice as well. But instead of bothering them, you're able to speak to somebody direct who is a specialist, has a bit more time to sit and think about things, and that was felt to be a really, really useful tool. So yeah, I think that there were lots of different reasons that we found that people referred to Consultant Connect. Thinking about diagnoses and advice on likely diagnoses, thinking about investigations, necessity of onward referrals, how urgent an issue was. There were quite a few different areas that people thought about, and people felt like they got useful advice in each of those areas. And one particular thing that quite a few people said, and there's evidence, in different ways, that Consultant Connect is preventing people being sent to hospital, because seeking this advice, getting some clearer management ideas, is really helping junior doctors in psychiatry settings, to get that appropriate advice, and that avoids hospital admissions and A&E presentations, which is overall a great thing. I think perhaps the most relevant thing to junior doctors is just that this is a tool that can be really, really useful for us. One of the things that lots of the people we interviewed said was this should be better publicised. I wish I'd known about this from day one, and we thought that was a really good ringing endorsement of the facility itself. People were almost always satisfied with the outcomes of their calls. People thought that they received helpful advice in kind of clear and sufficiently detailed plans. I suppose the most important thing, people almost always followed that advice. So clearly people thought that it was helpful. And it's a tool that's available. It's really easy to use, and it's always there at your fingertips. And it's pretty amazing that we can have that direct access. So I think the most relevant thing is just the availability, the ease of use, and the fact that it's there as a tool. I would say that thinking about what could be considered by other kind of mental health providers who might be implementing Consultant Connect, one of the areas that was highlighted for potential improvement by the people who we interviewed was kind of inconsistent connection rates at times and with certain subspecialties. So potentially useful features could be kind of including some clearer listings about availabilities of consultants or specialties, or a callback option. There were a couple of different ideas that were highlighted, but the main thing that was kind of felt by almost all the interviewees was that it was a really helpful tool. The only downside was when you couldn't get through. But normally people were able to, at least after a few tries if necessary. And continuing to implement and support it, I think would be really helpful to junior doctors and clearly has a knock-on positive effect for patient care.